what's up you guys? Thank you for joining me for another video. Quickly before we get started, I just wanted to let y'all know, if y'all are new to my channel, don't forget to subscribe to my Instagram that I made specifically just for my YouTube followers, guys. On there, it's a very safe place for y'all to talk, to vent, to get a lot of the behind scenes, what I do outside of, when I'm filming. I also have now started doing Tuesdays and Thursdays questions of the day, where I kind of post like a stock photo with a question, and then I'll give y'all my answer, and then y'all kind of just comment along below. A lot of y'all have already been doing that. It's a fun thing I do on my channel, you guys. And also y'all can privately message me if y'all have any questions, or if you just need to talk, like if y'all don't have any, if y'all are going through a loss or going through maybe a pregnancy or anything y'all might, or even with my work vlogs, a lot of y'all message me about that on there. If y'all just want to talk about anything and everything, guys, feel free to shoot me a message. I accept everybody's friend requests on there, guys. And without further ado, let's go ahead and get to the video. All right, you guys, thank y'all for watching another video. So today's video, I wanted to talk about, if y'all are new to my channel and y'all don't know this and y'all are just watching this for the first time, in 2020, I did have 3 pregnancies, 2 that were ectopic, and 1 that was a miscarriage. Now, with my first ectopic that I had, I was able to get the Methotrexate injection. Sorry if I'm saying that wrong. I'll put the spelling here below. I was able to get that injection, and I was able to save my left tube, you guys. So I only have my left tube, okay? At that time, when I got that injection, I had my right tube too, yes, but it was not untied from when I had tubal reversal surgery. Okay, and then a couple months late, well, how many months? It was about 5 or 6 months later, I ended up getting pregnant again with our 3rd one. And that ended up having to be emergency surgery, which ended up in my right tube, you guys. Okay, so I know a lot of you are going to be like, what the heck? How did that even happen? Look, you guys, I still do, and I was doing a lot of natural remedies to unblock my tubes. And this is why I really believe they worked, you guys, because up until then, up until I was taking those remedies, I never got pregnant on my right tube or anything like that. It was always my left side, or the miscarriage. So I never got pregnant in the right tube. When I started taking those remedies very, very strongly, heavily, religiously, I got pregnant, and it ended up being on my right side. And when they did emergency surgery, they said that my right tube was actually open. So yeah, guys, if y'all haven't seen that video or don't know what remedies I'm taking, I'm gonna link this all down below in the description box, you guys, so y'all can watch that, okay? So anyways, guys, let's go ahead and get into it. So with the injection, you guys, with that first ectopic that I had, I just wanted to explain to y'all exactly what I experienced, what happened after the injection. I guess you could say how I was healing and stuff like that. So between the two, if I had to say which one was worse physically, the surgery was. The injection was really easy as far as healing went and everything like that. So I did, and I wrote this all down, you guys, because I have a lot of stuff that I wanted to talk about. So if y'all see me keep looking down, that's why. So first thing they tell you is that you cannot eat green leafy food or anything that has folic acid. Like your prenatals have that, strawberries. I know there's other foods that have that. So they will let you know, you can't eat that. Now, they didn't give me a list of things that said not to eat, but I did look it up on Google, and I was able to see strawberries. I can't even remember what else, you guys. But I know definitely they said do not take your prenatals because it has that in there. So that was one thing. And the reason they said it has something to do with the injection and that food, they don't combine, they don't work well, or something like that, you guys. Honestly, I cannot remember, you guys. I have to do more research on that, and I just cannot remember what it was. The next thing was that I bled for about 4 to 6 weeks, and it was very heavy bleeding, you guys, with a lot of blood clots. So the thing that no one talks about is when you go through these injections, or even the surgeries, or even a miscarriage, you still have to shed all of your uterine lining and stuff like that, you guys. So when I was shedding mine, and I was actually in the shower both times when this happened, but when I was shedding mine, I was taking a shower, and I was just washing myself and whatnot, and I kind of felt something, and I was like, well, what the heck was that? And out came this pink, it almost looked, and I know it's gonna sound gross, but it was kind of fleshy, you guys. and that was the lining, I guess, of my uterus. And I called my doctor and they said it's all normal, it's gonna happen. I still had to shed everything. So that's one thing, you guys, that you are gonna have to, if that does happen, you know, I would recommend calling your doctor just to be on the safe side, but that's what I experienced. Another thing was that we could not have sex till I was done bleeding. So they told us to wait to have sex. And the injection site where I got it, I only needed one injection. I know sometimes ladies need multiple injections, or even like more severe cases, if their numbers are not dropping, they end up having all these injections and then having to have surgery. Fortunately for me, that wasn't the case. I was able to get one injection. It was kind of one and done, and my numbers dropped pretty quickly. But they gave it to me in my my buttocks and my butt cheek there, and the shot itself wasn't too painful. It was just the thought of everything that was happening, which is why I couldn't. And I wish I would have recorded everything, guys, but I just didn't at that time. But yeah, the injection wasn't painful. It was just like a regular injection that you would get. But just the thought of getting that injection and losing my baby and everything was really emotional. Now, for about a week afterwards, the injection shot was a little bit sore, but it was it reminded me when you get your flu shot and you're just a little sore there and you're trying to lift something, you're like, oh, it's just a little bit sore. It was the same way. It wasn't anything that was, you know, like it didn't hurt a lot or anything like that. Another thing was that, now this is where my doctor told me, this is what my doctor told me. Okay, now it's gonna depend on everyone else. Everyone is different. Do what your doctor tells you, okay? Don't just go off base what I'm saying. Now, my doctor said that we could wait one full cycle after the surgery. One full cycle after the injection until trying again to have a baby. So I know some doctors say with that injection, they want you to wait 3 months, 3 cycles until trying to conceive again. My doctor said wait 1 month. We did. We got pregnant again, you know, after we waited 1 month, and then that resulted is when I actually had my miscarriage, you guys, which I haven't made a video about because I just haven't brought myself up enough courage to talk about that miscarriage because it was really hard also. But that's what my doctor said. I know a lot of ladies say my doctor said wait 3 months. Mine said 1. So it's kind of back and forth because there is some ladies who say my doctor said wait 1 month also. So I guess every doctor has their own recommendations on that. Now, I did have cramping that whole time, like heavy period cramps for about 4 to 6 weeks. And it was a lot, guys. It was bad. It was just all like in my abdomen area, my hips, it was in my back. It was a lot of cramping. I remember when I did go back to work after I had the injection, I want to say I went back a month afterwards. And I know I went back way too soon, but I went back a month afterwards. I was still crampy. Like if I was like moving around a lot and stuff, like I'd be hurting. But my work is so understanding. Well, my boss too. They're so understanding, and so are my coworkers. They knew what I was going through. They knew that physically I didn't feel good. They knew mentally I really wasn't doing well. So it was tough, you guys. It really is. And what I do for work is I'm with patients all day, or I'm with my boss scribing all day. So it's hard to just it was hard to keep myself like not crying and stuff because like I was still going through a lot. That's why I said I went back to work way too soon. I remember one day I was sitting there at work and I was just like studying in my guide, and like I just started crying. And we didn't have any patients that day, thank God, but I remember just telling my coworker, I was like, I can't be here right now, like I need to go home. And I left and I went home. And yeah, guys, that's a whole nother story that I'm gonna end up doing for y'all. But anyways, so the last thing, you guys, as soon as I got the injection, and this is something I think that everyone and I know that everyone is different and may not have the same support system I have and stuff like that, but I think that if everyone gets this injection, they do need to have somebody there. That's just my opinion, because when I got my injection, and everyone handles it differently, but when I got mine, guys, instantly afterwards, I'm not even kidding, because I was sitting in the room about 30 minutes after the injection, not because they were watching me, one, because they were watching me for about 10 minutes to make sure I didn't have a reaction, but 2, because it was real emotional, and me and my significant other were just like crying and crying, and we both couldn't stop crying. They didn't want us to just walk out like that. So about 30 minutes afterwards, you guys, my vision got so blurry, and I wear glasses, you guys. and it felt like I wasn't even wearing glasses. It felt like I had my glasses off. And have y'all ever crossed your eyes? Like when y'all were little kids, you used to cross your eyes, and you know your mom said don't do that or it's gonna stay like that. That's literally how my vision felt for a whole week, you guys. So it was like that for a whole week. It felt like I didn't have my glasses and that I was cross-eyed. Like I would trying to watch TV. I couldn't. I told my doctor about it. He said that's completely normal. Some people have they all have different side effects. But he did advise me do not drive. So that's why I was thankful. Like I had my significant other there with me for the emotional support and everything like that. And he drove me around. So that's what I was saying. Like I really think that it's good that you take somebody there with you. If you're about to have the injection and you're watching this, I do think that you do need to take somebody there with you, not only to drive you home because it's very emotional, but also you don't know what your side effects are going to be, and you just need to have a support system there, and that's just in my own opinion. But that's pretty much it, you guys. That's really what I experienced with the injection. Physically, it wasn't too bad as far as the healing went. Mentally, I'm still healing from that because that's a big scar I'm gonna have for a long time, you guys. And I'm still working on that. So now the next one, you guys, surgery. So if y'all haven't seen when I had emergency surgery, I'm gonna link that all down and put in the description so y'all can watch the video. But I just want to get into how my post-op, how I was healing and everything I experienced. Okay, guys. So I did bleed for about 3 to 4, maybe 5 weeks. I know I didn't bleed as long, surprisingly, as when I got that injection. So I bled for about that long. It was heavy, you guys, just like it was when I did have my injection. It was very heavy. There was a lot of blood clots, and I did shed my lining also. The next thing, you guys, I had the worst gas pain, and not like gas like I had to fart. It was gas where when I had surgery and they lay you down, they put these those prongs in there and stuff, and they fill your stomach or your abdomen and stuff with gas, so that way that they can work around inside your body. And that's the gas pain I'm talking about, because when they come out, the gas doesn't come out, guys. It stays in there. So you have this big freaking gas bubble just chilling there in your body, and it is so painful, you guys. Like, this gas bubble just loved coming up, like it felt like into my chest. I think it was coming into my freaking diaphragm or something, and I couldn't breathe. It would go into my shoulders all the time, like right here. Oh, guys, that was painful stuff. Okay, guys, if y'all are about to have laparoscopic surgery, I am gonna link the video in the description, guys. I highly recommend that y'all watch it, because I give y'all tips and tricks to recover, you guys, stuff that I didn't even know, and I put it out there for people who were gonna have this surgery. So just in case y'all do, y'all can know what to get prepared for, you guys, because it is no freaking joke. It hurts. Now I had that gas pain for about 5 days to a week. So mine, that air bubble slowly, what do you call it? It slowly got absorbed over time. Now, some people say they have it for like 2 weeks to 3 weeks. Thank gosh I didn't. Anyways, okay, so the next thing is I couldn't have until we went to our 1 month post-op appointment, which I was completely fine with because I had that gas pain and I was bleeding and I had a lot going on. So we were okay with that. Once I had my 1 month post-op appointment, my doctor gave me the okay to have sex, and he said, you know, once you have 1 cycle, you can try to conceive after 1 cycle. So that's what he told us. The next thing is, you guys, they didn't give me stitches. They actually gave me they used glue, like that medical glue. So they went into 3 areas, 2 on my side, and then 1 that's like a little bit over here. I'll put some pictures so that way y'all can see how it looks. But if y'all haven't seen my laparoscopic video, I showed y'all exactly how it looked and everything, like a few days after having surgery. Anyways, what do you call it? So they just use glue, guys. I know some ladies get stitches that are dissolvable. I didn't. They just use glue, and the glue fell off about a month and a week afterwards. Like, they told me don't pick at it, like it looks weird, it looks a little gross, but don't pick at it, just let it fall off by itself, kind of like a scab. And I did, and slowly I could see where it was like wrinkling up, and then it just fell off by itself. And the next thing was let me see. So I had I remember this, my abdomen was like super sensitive, you guys, for about a month. Like all right here, it was just so sensitive, you guys. Like I would touch it and I was just like like I had to be like real careful with it. Like I like to wear a lot of leggings and I couldn't really wear them that much. I had to just wear sweats, like really big baggy sweats, because it was hurting, guys. Like anything that was like pushed up against like my stomach and stuff would just hurt. So I had to wear baggy sweats. And then another thing was, okay guys, I know this doesn't sound gross, but I had like the worst pain when I was making bowel movements. So especially my first one after surgery, that one hurt so bad. So it's all sensitive down, like all like right here, your stomach, your abdomen area is just so sensitive, you guys, that like any little movement hurts. So when I went to the restroom, like I couldn't push. I would just have to just like sit there and just let it come out. I know, I'm so sorry. I know it sounds gross, but I had to just do that. Because like guys, I tried to like just do like a little push and oh heck no, like that hurt. I was like, oh god, help me. Like it hurt so bad, you guys. I'm sorry guys, I'm not trying to make fun or anything. I'm just like, it hurt, like it really did. So they advised me to take stool softeners, and I did, and it did help. It helped, like, you know, help it maybe a little bit easier to make a bowel movement. But for about a good month it was hurting. Not as much as it did that very first time, but like it got better gradually over the month, but it did hurt. So I would advise y'all, if y'all are gonna have the surgery for an ectopic, do take stool softeners afterwards, you guys, so that way it can help when you do make a bowel movement. And the next thing was, oh, I already told you that I was out of work for about oh, I didn't, sorry, I'm thinking the other one. So for this surgery, I was out of work for about a month and 2 weeks, and then I went back, and then when I went back, I was just strictly kind of like on desk work, because I knew I was still trying to heal. Like every time I was on my feet for too long or walking too much, like this movement when you're walking, like it would hurt, like all right here. Like it was just so sensitive, you guys. I can't really even explain it. It was extremely sensitive, and they understood, so they just had me doing like desk work. But even then, like I would have to like sit back like this, because like my scrubs would freaking hurt, you guys. Like it would be like hurting my stomach. And then it got to the point where, because I couldn't just wear big baggy sweats to work, you know. So it got to the point where I just had to like lower my scrubs like way below my belly button. Like I just had to push them down to kind of like help it. Another thing was that when I had to sleep, you guys, with this surgery, I had to actually sleep like in an incline because of all that gas. Because if I try to sleep flat on my back, heck no, guys, that gas was gonna be like up in my chest, in my shoulders, all that stuff. I couldn't sleep on my sides because then the gas would go all to one side of your body. So I had to sleep at an incline. How long did I sleep at that incline for? I think I just slept at it till maybe for a little over a week, till I felt like the gas was fully gone. It wasn't like, so that, yeah, my abdomen was sore and stuff, and I could handle that. It wasn't too bad, but the thing that was killing me the most, you guys, was that dang gas. Like, I'm not even exaggerating, that stuff hurt. It was horrible. But that was pretty much it, you guys. That was the difference that I experienced between having the injection and having surgery. What was my experience post for both? They were both two different experiences, you guys. Even when I was pregnant, both of those pregnancies were different. Now mentally, it's all the same, you guys. The pain, it still hurts the same. I still grieve for those children that I lost. So that is all the same, but recovery, symptoms, everything I was going through was different. It was completely different. But that's about it, you guys. That's all I have. I just wanted to get this video out there for anybody who is curious, you know, as far as like, well, what's the difference from the injection and surgery? Because I also know that with if your tube hasn't ruptured yet, you guys, well, at least my doctor, he offered to do surgery. So when I had my first ectopic, he gave me the option, you know, do you want the injection? We have time to inject. Or do you want to do surgery? I go in there, try to save the tube, and if I am able to save it, clean it up and everything like that. Now, the first time we opted out of surgery because we were, I mean, there was a 50-50 chance. Either he's going to be able to save the tube or he wasn't. And he told us flat out like that. So we went ahead and went with the injection. We felt that that was best. And I'm so glad we made that choice, because I, thank gosh, still have my left tube that is open. And we are still trying to conceive. So hopefully, we're very hopeful that we'll get a rainbow baby someday, soon, hopefully. But yeah, guys, if y'all are going through this, I'm so sorry, you guys. Like, I know it is so emotional. I know it is confusing. I know it is very lonely. Even if you have a great support system, it is still extremely lonely. It's a very lonely road. And I'm so sorry that y'all are going through this. But like I said at the beginning of the video, add me on my Instagram, you guys, and y'all can always shoot me a chat. Just if y'all just want to cry and vent. Maybe your family isn't supportive. Maybe whoever you're having this baby with just doesn't understand. You know, whatever it is, you guys, maybe it's just not even about this and y'all just want to talk. That's okay, you guys. Add me on Instagram and y'all can privately message me. I don't mind if y'all comment on here. I'm completely okay if y'all want to comment on my YouTube. I just don't want anybody to try to chime in and say anything mean and hurtful or ugly, because I won't put up with any of that stuff, you guys. If anybody wants to be mean or ugly on here, y'all will get straight deleted and blocked off this channel. That's it, because that's not fair to my loyal subscribers who are supportive and loving towards me. Like, I'm gonna stand up for them. That's not right. But anyways, guys, I didn't mean to go on that whole rant, but I hope y'all are having a great day, and I hope y'all enjoyed this video, and I hope that it does help somebody out there who is going to be going, hopefully, I hope it helps somebody that is going through this, because like I said, I know how confusing it can be. But anyways, guys, I'm gonna go ahead and head out, and I hope y'all enjoyed it. I'm wishing y'all nothing but peace, love, and a ton of happiness, you guys. I'll see you on the next video. Bye.